Thank you, Mr. Chairman. I appreciate this committee's efforts to educate all of us on legislation that could help our seniors who rely on Medicare. I support H.R. 5269, the Results Act, a bill that's been introduced by my colleague from North Carolina, Representative Hudson. This bill would make vital reforms to Medicare's clinical lab fee schedule, which pays for lab tests New Jersey seniors rely on for routine care and for the diagnosis of more complex conditions like cancer. In New Jersey, there are over 2,300 laboratories. In my district, there are over 200. Ms. Van Meter, can you articulate the urgency of reform needed for Medicare's clinical lab fee schedule?
Yes, thank you, Congressman. On January 31st, about 800 tests will get cut by up to 15%. The cuts are going to hit tests that are among the most routine that Medicare beneficiaries rely on every day. Those kinds of reductions will have an impact on beneficiary access to services. It will also stifle innovation in the next generation of diagnostics those same patients need and deserve.
Thank you. In New Jersey, as a follow-up on this, we have several companies with great employees who are developing new diagnostics to ease the process of diagnosing suffering patients. These include companies like Roche Diagnostics or Thermo Fisher. In your testimony, you mentioned innovations in biomarker testing or rapid whole genome sequencing. First, can you explain to us the exciting hope that these new tests can promise to patients, including those with rare diseases?
Yeah, absolutely. Biomarker tests can be used in a variety of conditions and diseases, cardiac, neurological, cancers, many others, and it is the foundation for precision medicine. In other words, being able to plot a personalized course for patients on the best medicines, best treatments for their particular condition. We're seeing tremendous growth in this field, bringing treatments and improvements and saving lives for patients. With rapid whole genome sequencing, that technology is uniquely situated to diagnose rare diseases. Thousands of rare diseases can be diagnosed using this technology, and that's essential for patients who are living with such diseases and conditions.
And can you explain how the current Medicare clinical lab fee schedule under PAMA is affecting the development of these tests and the ability of these patients to access them?
The key to ensuring that we have long-range research and development is a stable and predictable Medicare payment system, and we do not have that right now under PAMA. There are years of cuts that have taken effect, and there's a constant threat of deep reductions over the field. While innovation has been happening, with that threat of constant cut, looking out for long-term research and development certainly is compromised, and that includes the work that we can do in biomarker testing and beyond.
So currently, CMS would rely upon data from 7 years ago, 2019, to determine the reimbursement rates for lab tests. In your testimony, you write that around 1/3 of lab testing codes are new since 2019. Without some type of changes to the current system, could you give us your thoughts on how realistic it would be to expect CMS to gather stakeholder input, individually determine the price of each one of these codes? And what impact would further delays on these repricings have?
It's an excellent question. So yes, because there is constant innovation, there have been hundreds of new codes that have been established since the last data collection period, but that would not be captured within the 2019 data that labs are due to report come February 1st. And CMS will not have any commercial market data upon which to make any changes to those rates for those tests that have been established since 2019. We've consulted with CMS. We've encouraged them to use the rates that have been set to date. We think it's beyond the scope of what's reasonable for the agency to do to really update those rates. They should be maintained. But most importantly, if we move forward with the Results Act, that becomes a moot issue.
Thank you to all of our witnesses for being here today and your valuable insights. I yield back, Mr. Chairman.